Respected CMD, my colleagues, sisters and other medical staff, almost regarding breastfeeding, almost 2/3 subjects is completed, unless the last 1/3 question I will cover. Breast milk is the best milk, the gold standard. The best milk for the newborn baby is unquestionably best milk. All healthy normal weighing babies must be exclusively breastfed till age of 6 months. The reasons being, the breast milk contains all the food materials that is very essential for growth of the baby as well for growth of the brain. The galactose part of this breast milk and also the essential fatty acids, they are very essential for growth of this grey matter and white matter. The thing is that when we are giving round in gynae ward, you see all the mothers, they will first complain, sir, हमारा ठीक से दूध होता नहीं, बच्चा पी नहीं सकता. But that is a wrong belief. They are not mentally prepared to feed the baby. But initially that thing occurs after 40 to 72 hours. Again the milk system become adequate. So within that 2 days they can have the confidence and they will resort to some artificial feeding. So it is our duty to counsel the mothers antenatally during antenatal checkup, during internatal period and postnatal period, so that they must be mentally prepared to feed the baby. Regarding this anatomy of the breast, is a fibrofatty tissue having acinite to produce the milk, and the secretion is entirely dependent upon this reflex phenomenon. When baby is sucking the milk, the impulse goes to the brain through neural channel, and it activates production of prolactin. Prolactin causes this formation of the milk, and the oxytocin from the posterior pituitary causes ejection of the milk. And you see the structure, these are the lacteals, the sinuses that is beneath the areola. This portion, milk comes here and gets deposited here. So regarding the proper latching or proper positioning or proper feeding, what has been already discussed, the aim is that the baby's mouth should be here, so that when he is pressing, the milk will eject out. That is proper latching, already it is discussed. And the entire reflex, that is this prolactin reflex or the oxytocin reflex, everything is mediated to psychology of the mother. Even the mother, if mother wants to feed the baby, mother have the sense, the smell of the baby, even the sight of the baby, it will cause ejection of the milk. So the basic thing is that mother must be motivated to give milk to the baby, and that is the best thing that can produce maximum milk secretion. This is ejection reflex. Milk is produced as a result of interaction between the hormone and the reflex. During pregnancy, the glandular tissue is stimulated to produce milk due to various hormones. Two reflexes mediated by two different hormones come to play during the lactation, that is prolactin reflex, oxytocin reflex and sucking reflex. This sucking reflex is the highest during first half an hour of life. That is why it is advocated that immediately after birth, baby must be allowed to suck, and after 1 hour it gradually wins out. That's why because of some constraint, it has been advised for cesarean baby must be fed within 4 hours, and the normal baby within 1 hour, and the best result is within half an hour. The advantage of the breast milk is, it is advantage to the baby, it is the advantage to the mother, and there is a combined advantage to the family also. It decreases the mother. Just imagine the mother who is feeding the artificial feeding at the dead of the night when baby is crying. She has to wake up, she has to prepare, and they feed the baby. That's by this process, his original rest is lost. She is not able to take rest. So the other day she will be fatigued. This causes again decreased secretion of the milk. If mother is feeding breastfeeding, then she is able to take adequate rest, and there will be adequate production of milk. There is low risk of infection also. There is low risk of breast cancer and ovarian cancer and other things that are already discovered by Dr. Somapika. It also causes involution of uterus after delivery. Due to this oxytocin secretion during this process, it reduces the uterus size, it comes to as a pelvic organ. It also delays the pregnancy, it is already discussed by Somapika. Then better brain growth. brain growth is essentially depends upon the breast milk. It promotes emotional bonding, and that is the main bonding between the mother and the child. It protects against infection. There are so many anti-infective agents are secreted in the milk, particularly interferons, immunoglobulins, lactoferrins, lysozymes, and these things they protect baby from different kinds of infections. Particularly this lactoferrin that prevents growth of E. coli bacteria and other bacteria who depend upon iron pigment for their growth. And this is beneficial to the family. It saves the money. It promotes family planning because of the spacing due to oxytocin. These are some statistics. How much babies are breastfed in our country at different age group, and below 3 years of age, only 27% of babies are breastfed within first hour of life. Types of breast milk. The colostrum is the first breast milk which comes out after delivery for first 7 days. It is a concentrated milk, high fat content, high immunoglobulin content. So giving colostrum to the newborn is just like giving primary immunization. So there is a taboo. Almost all people think that it is a witch milk. That's why they extract this milk and throw it away. They don't give this colostrum to the baby. Then the transitional milk. After colostrum, after 1 week the milk comes, which is high in content in protein and immunoglobulin, but the sugar content is less and fat content is less. But after 1 week, in the mature milk, it is quite balanced and contains adequate amount of protein, minerals, vitamins for optimal growth of the baby. Then preterm milk. When a baby is born preterm, the milk constitution and composition changes. It is the law of nature. As the baby requires more protein, more calorie, more mineral, because all these things are getting deposited in baby in third trimester of pregnancy. So they need more amount of calcium, iron, and all other things. So in premature preterm milk, these contents are high. For milk, the milk which is secreted initially, it contains sugar, vitamin, minerals, and protein in all proportion, but the fat content remains high in the hind milk. Suppose the mother is feeding the baby and in the half fed, it crosses over to the other milk, the hind milk will not come together and the fat content will not come. And this fat content so many essential essential fatty acids like linoleic and linoleic acid, which are very, very essential for production of different cerebrocytes, which is essential for growth of this grey matter and white matter. Colostrum. Colostrum is rich in antibodies. It also has cellular component like T lymphocyte and B lymphocytes. It has a growth factor which promotes maturation of the intestinal cells, and it is highly saturated with the vitamin A content. Among the immunoglobulins, most important is IgA, which protects from the intestine from infection. Then lymphoid cells and macrophages, lactoferrin, and lactobacillus bifidus factor. These bifidus factors promotes growth of lactobacillus bifidus in the intestine, which suppresses the growth of other pathologic organisms. This is the constituents of human milk and other milks. You can find the protein content of cow's milk is almost 3 times that of the human milk. Sometimes it so happens this cow's milk when comes in stomach acidity and there occurs a casein, and sometimes the block is so much big that it can produce intestinal obstruction. Similarly, in buffalo's milk, you see the fat content is high. So by feeding buffalo's milk, we must remove that fat content, that cream, and as the sugar content is low, for each 120 ml of buffalo milk, we must add 1 teaspoon of sugar to match with the mother's milk. The other parameters which are present in only in mother's milk are these immunoglobulins, lactoferrins, lysozymes, complements, interferons, T and T lymphocyte, and the bifidus factor that I have already discussed. These are not present in cow's milk, though they are present, but not for the organism to which the baby is sensitized. So it is not active. It is not active for the baby. So different minerals and vitamins are also on different proportion in cow's milk, human milk, and goat milk. And particularly cow's milk contain more sodium, more potassium, and the electrolyte load is more. So this increased electrolyte concentration gives a load to the premature kidney and causes more urination. Regarding the proper position of the baby, Dr. Chatterjee had already discussed. The main aim is that the baby should be comfortable, the head and body should be aligned in proper position, the maximum portion of the areola should be inside the mouth, and chin should touch the areola, and that is called proper latching. The upper figure, this is improper. This is poor attachment, and this is poor attachment, and this is good attachment. The base areola is visible above the baby. The baby's mouth is wide open. The baby's lower lip is turned outward. The baby's chin touching the breast. The 4 key points in proper positioning. The head of the baby and body should be straight. The baby's face should face mother's breast. Baby's body should be close to her body, and she should support the baby's whole body. How frequently a mother should feed? This is a usual question. Actually, every 2 to 3 hours, the mother should feed or on demand. And if the urination is adequate, 8 to 10 times over 24 hours, baby is calm and quiet and sleeping, taking adequate rest, the growth is optimal, then it is the sign of adequate breastfeeding. Practices which increases bonding, that is rooming in, that baby and the mother should remain in the same room. Bedding in, they should be in the same bed. The mothering in, that means baby should keep her baby over the chest, that is kangaroo care. By that, in premature baby, it gets warmth from the baby and it is prevented from hypothermia. Issues regarding which hampers the breastfeeding already that is covered by Dr. Somapika. Then milk banking. Actually, this is an artificial procedure. Also, on compulsion it is done when mother is very sick, mother is not able to feed. In that case, milk is extracted and kept somewhere and fed the baby. If it can be kept in room temperature, it can be kept for 6 hours. In fridge, it can be kept for 24 hours. These are the conditions when there is some problems with breastfeeding and jaundice in newborn. It is not actually a contraindication. If it is due to only breast milk jaundice, then we can discontinue the feeding for 24 to 48 hours. It is due to a steroid preparation of the mother from her body, like tretinoin, that causes this type of jaundice. You just discontinue the breastfeeding for 48 hours, again recontinue, that jaundice will disappear. Then in hair lip and hair cleft, it is some mechanical effect because baby is not able to produce some sufficient negative pressure. That is the cause milk is not secreting. We have to help the baby by extracting the milk and feed by spoon or katori or by a long nipple which is available. You can cover that the cleft lip portion so that baby can generate adequate negative pressure in her mouth. The congenital heart disease. In congenital heart disease, when baby is sucking, it is a type of exercise. Baby gets fatigued and may go into failure. And in artificial feeding, as the salt content is high, the failure is more precipitate. Feeding of the preterm and low birth babies. In the next slide, I will discuss. Then feeding with twin babies, already Dr. Samika has told. And breastfeeding and viral diarrhea. In diarrhea, breastfeeding should not be discontinued. The baby weighing less than weighing around 1.8 kg, if their sucking and swallowing reflex is coordinated, they should be allowed to breastfeed if they are mature enough. Other babies, they can be fed the express breast milk by spoon and katori. Feeding the twin baby, it is already discussed. Why lactation failure occurs? These are the conditions why total working mother, small family, second female child, tension to the mother. So whatever the cause, the single positive cause for lactation is the intent of the mother. If mother wishes to feed baby, so these are nothing. These are nothing. These entrances will not prevail. 10 steps of subsequent breastfeeding, it is already discussed. And regarding drugs and contraindication in breastfeeding, particularly antithyroid drugs, anti-cancer drugs, lithium, and these are contraindicated totally in breastfeeding. And other drugs, there are some partial contraindication. Thank you.